Welcome to our monthly community conversation. We're happy and excited to have everyone here with us tonight. I want to just give a brief description of today's conversation. Today's discussion is really centered on empowering individuals to advocate for their health and wellness with confidence and pride. We'll explore strategies for effectively communicating during medical appointments with your primary care, even your dentist, asking the right questions, and understanding available options to you so you can make a really well-informed decision about your health and well-being. We have two awesome, lovely panelists here, Joanne and Cheryl. And I'm going to give them a few minutes just to kind of briefly introduce themselves. So, Joanne, you want to briefly introduce yourself, share
Sure,
who you
sure,
are, your role, and the organization you're from, and how you came to do this work around health advocacy.
sure. Thank you so much for having me, Rosie.
Yeah.
My name is Joanne Silver Winbush, and I am the Patient Experience and Outreach Manager for Health Center in Dorchester, which is Codman Square Health Center. I came to Codman Square Health Center in 1992 as a coordinator who worked very closely with the community and inside this health center. One of my main functions were getting folks signed up for Mass Health, and then showing them how to navigate the system. So that's how I became, and it's 33 years loving what I do. So that's why I'm here to answer any questions or any concerns that you may have that I have the expertise in answering.
Thank you so much for sharing. We're so happy to have you.
Thank you.
Cheryl, how about you? Brief summary of who you are, your role, your organization, how did you come to do this work? Oh, you're on mute.
Okay, I'm off now.
Yeah.
Um, it's really great to be here. It's absolutely a privilege and an honor for me to be a part of this conversation that's so important. Like you said, my name is Cheryl Harding, and I'm the strategic advisor for Everyday Boston Storytelling to Build Medical Trust Curriculum Project. That's a mouthful, but that says a lot right there. And I started this work a long, long time ago as a community advocate, as a community organizer. And I worked specifically with engaging with people around many issues when I actually became the statewide field director for Andrea Campbell's Attorney General campaign. So it's meeting people from all over where they are and finding out that our issues are basically the same because we don't know how to stand up for ourselves because we've always felt like we've been alone standing up for ourselves. But through conversations like this, we realize that we're not alone, that there is power in numbers, and we can absolutely empower each other to go ahead and get what we need from a system that we know is already broken. But hopefully, we can begin with all of us to put some pieces together.
Out of context. She now says it was weeks.
I totally agree. We're here to really, empower people to speak up so they don't feel, afraid and doubtful of what their concerns and questions are, right? So we need to heal on a deeper level, on a cellular level, not just for ourselves, but for our communities. Great. So we'll get started. So feel free, I just want to say, if people have questions along the way, feel free to put them in the chat. We're going to have an opportunity from 7 to 7:25 for questions and answers from the panelists. So feel free, if you feel like you have a question, an urgent question, and you don't want to hold on to it, throw it in the chat, and then I'll come back to it, and we'll be sure to get to it. But you also have the opportunity to raise your hand around 7 o'clock to ask any question you have. So this question is for both of you guys. I want to ask both of you to define what does it even mean to like advocate for yourself? Like, what does self-advocacy look like? Let me repeat that again. Sorry, there was some noise. So I want to first ask both of you to define what it means to advocate for yourself. What does self-advocacy even look like?
Mhm. I can start by answering that question.
Okay.
And for me, it's taking myself from the victim to being a partner in my own healthcare, in my own life's journey, where I'm no longer in a position where I'm just going to accept that what you say is what's right for me, because I need to tell you what's right for me. I need to make sure that you understand what it is that I need, but more importantly, how I need that delivered to me in a way that I understand it, in a way that I feel like you heard what it was that I'm saying that I need about me. And there comes a point when if it's not about me, then it becomes you. So I need to actually speak up. My grandmother always used to say, a closed mouth don't get fed. So it's like until you actually, me, stand up to say, hey, hold up, wait a minute. You misunderstood what I said, or I don't understand what you said. And so we need to then begin to have a conversation. And that's how I get what I need. But more importantly, hopefully, you're getting what it is you need as the provider to take the best care of me.
Yeah, thank you for sharing that. Want to
Yes.
jump in, Joanne?
I totally agree with you, Cheryl. I totally agree with you. So for me, it's knowing yourself, knowing who you are, knowing what you need, knowing change within you,
Mhm.
seeing this change, knowing how to advocate for that change, and not being afraid to speak about it. I think that's one of the biggest fears a lot of folks have. Just because there's someone in a professional role, it doesn't mean that they know best. Yeah, they may be the expert, but you know you. And so this is key, knowing you and who you are. I mean, you can't tell me what's going on under here. It might be something going on under there that you don't know. And
That's
I
right.
know. So I'm going to share that. So I think when it comes to advocating for oneself, it's more about knowing you, your body, your soul, your mind, and anytime you see change in any of the following, just knowing how to reach out and who to reach out to have a discussion to see if there's really anything going on, or just to get it looked at because you're your own advocate. You have to speak up.
Mm.
And to Cheryl's point, what was the saying you said your grandma said, Cheryl?
Closed mouth don't get fed.
That's right. And I stand behind that.
Yeah, I remember that. I
Yes,
hear that all the time growing up from my family members, and it's so true. But so
that's
often
right.
we don't know how to advocate for ourselves. We don't feel confident enough to do that. Like I was thinking of self-advocacy for me is like knowing your worth and really understanding that you have a voice in your care, right?
Mhm.
That's
And
right.
showing up informed, like stating your needs with confidence and making decisions that align with your values and what you
That's right.
feel is right for
Mhm.
you, for your body, for your health, right?
Mhm.
That's right.
It also means trusting your intuition. Because most
Yeah.
of the time we kind of know something's going on sometimes, and we're like, push that to the side. No,
Mhm.
Push it
if
to the side.
something doesn't sit right with you, it's okay to speak up and seek a second opinion,
Correct.
right? Thank you for that. So let's move on to the next question for both of you guys again. Can you tell us what advocating for your health and wellness look like at a doctor's appointment? What could that look like?
So for me, it's like being prepared for that appointment, walking into that appointment, and noting just some of the things I just shared, just noting things that have gone on with you that have not gone on with you before, having it probably written down so that you don't forget anything, um, being able and not ashamed of anything. So a lot of us get ashamed on certain topics. If something's going on with us and we're feeling certain feelings or thinking certain things, not being ashamed to discuss it, but definitely have it written down. Definitely being patient, um, listening to the provider, but definitely getting your voice out there. We do know some appointments are rushed, but
I would say asking questions too.
you have a voice. You know what I mean? You have a voice and they will listen. They have to listen. And
Mm.
just knowing your patient rights alone tell you when you get in that room, you're advocating for you. You're asking every question, just what we just spoke about a minute ago. Ask the question, document the change, bring your medication, make sure they know everything that's going on with you and any previous diagnosis. That's a doctor's visit and you're in control, not the doctor. You're in control. So just remember that. And you have the right to be.
Mm. How about you, Cheryl?
Mhm.
Want to pick
And
up?
echoing what Joanne said, for me, it's like I need to go in a position of strength because, like Joanne said, you know me. I know me mentally, physically, spiritually, emotionally. So you can't tell me about that. But what I also realize when I go in is that if I want you to become a partner with me, that I need to be completely honest with you. I need to tell you exactly how I feel and not like, well, how have you been keeping your blood? Well, my blood pressure's been okay. No, if that blood pressure's been high, then that doctor needs to know about that.
That's right.
We go in at times feeling so low, so unworthy, so that we feel like we have to present ourselves in the best light possible so that they'll look at us favorable. But that's not helping us. And that's certainly not helping the provider that we're trying to put trust in for them to take care of us. So I think that when you go in knowing who you are and understanding that you are going in as a partner, not as a victim, not as somebody that's going to sit there and say, yes, 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 yes. You have questions. I keep seeing in the chat, you make a list, you make a list. That's so true. But I also say, you never need to go to a doctor's appointment alone. You
That's right.
always need to have somebody there with you because, first of all, you're afraid because we have been harmed. We have been disrespected, dismissed. But when we have somebody there, then we take away all those emotions and we have somebody that, what, just the facts, ma'am. Just give me the facts. And somebody that will remember and document these facts. And then that's what, to me, it's advocacy. And you're going to get the best you can out of a short period visit. And we understand that. But we, the patient, we, the person, we, the human, have to give as much as we can of ourselves and trust that that person's going to do what's best with the information that we give them.
Mhm.
Exactly.
Thank you. Thank you so much. I'm a yoga teacher, so in my class, I always start by saying, I am the guide, I'm the facilitator. You are the teacher.
That's
Mhm,
right.
You're the teacher because you know your body best,
That's
mhm,
right.
right? So these are just thoughts, ideas. Try them. If it doesn't, you can adapt my cues to your body, like whatever works for you. So I always remind people, and I remember when I first heard it from a yoga teacher, I was a little shocked because I never looked at myself as a teacher
Mhm.
of the self. So that resonated so deeply with me that I really started advocating for myself more, even though there were like times that I was still like unsure. But the more I did it, the more I felt empowered, like I
Mhm.
was taking charge of my health and well-being because I know what's wrong with me. I know what I'm feeling,
mhm,
right? And like you guys said, like don't feel shameful about it,
That's right.
right? Because there's a lot of shame that comes with feeling what you're feeling,
mhm.
especially as a person of color.
Southwest is, and of course, side blood rabbits.
All right, can you see me? You can see me.
Well, that's pretty
So
good.
yeah, for me, it really like, it looks like bringing your symptoms. That's what I do, bring my concerns, my questions, and ensure like to stay on track during your visit because I find you can get sidetracked a lot. Did you do this? Did you do that? No, I have some questions. Like you said, the
Mhm.
visits are short, trying to make your doctor's visits a little bit more intentional. And then also like clarifying, if you don't understand something, don't be afraid to say, hey, can you clarify that? And for a lot of people, I realized like my mom doesn't speak English. So she has to go with a translator, right? And if I'm not there, I write a note for her, ask for a translator. There's always a translator I find available that can help assist, because sometimes it's hard to comprehend certain things that are happening with you in medical terminology. So,
And also they have to, if you feel like you're not being heard, there's an escalation process. You can go and ask to speak with others, to take that concern at a higher level, so they can address that, because listening is a skill, it's an art. And they have to listen well to give you what it is that you're asking for. So it's very important. If you feel like you're not being heard, you're not being listened to, take it a step further.
That's right.
There is another step, to address, because they report into someone as well, and they have a board over them. So remember, we all work in these positions. We report in somewhere, and just know someone will address it.
Rosie, I think Denise had her hand up for a while.
oh, sorry, we're gonna do questions at the end.
Oh, okay.
Let me just write. We will have time at the end. We'll probably try to end 5 to 7, so people will have ample time for people to ask questions. But in the meantime, if you do want to put them there, feel free. But if not, I, ask that you wait till we're done with the questions in the panel. Okay, next question. So can you explain what rights patients have when it comes to advocacy for their health during a doctor's visits? Because I find most of the time when you go into the doctor, say you're new to the clinic, they'll give you the patient right. There's a document they give you. And most of the time, I know I haven't read it, so I'm like, we need to stop paying attention more to that. And, and I'm like, you can request your chart, to see what's actually on there. And it's something I had never considered till I was like actually working on this topic. So I'm curious to know, like, how do you go about asking? Can you just ask for your patient's rights in writing? Can you ask via email? How does that work?
I have never read the patient's Bill of Rights. I mean, I have to confess right down front. But I know for me that I have the right to be respected. I have the right to be heard. I have the right to have my questions answered. And I certainly have the right to be looked at as a human being without finding out where my zip code is, what color my skin is, how high I went in education. I mean, I have the right to be treated and respected as the human being that I am. So, whatever the language is administratively, and I say that very loosely because it's designed, that patient Bill of Rights, to cover the administration to make sure that they can say that they have dotted all the I's and crossed all the T's and gave you understanding. We don't read that. We just don't read that. So it's like once I think we get together as a community and say, wait a minute, that may be what you need to cover you. These are the Bill of Rights that we need to cover us. And it starts with you treating us as humans.
Thank you, Cheryl. So for me, so the patient rights, and to your point, Cheryl, a lot of people don't look at it. So usually on an initial visit, it normally would happen at an initial visit, you're given those patient rights. And like you said, it's so broad, nobody really looks through it. I mean, it's so much to read. It would be nice if it was put in a different perspective, probably just a lot of bullets, just write down, just list everything. I think that would make it much more legible for
Yes.
folks. at least to get understanding, because, we talk about you have to understand what it is you're being given.
Mm-hmm.
But the staff have the responsibility also to explain to you what it is. So if you ask for your patient rights, they have to put that in your hand.
Mm-hmm.
Okay, so if you ask, well, what are you going to do with my information? They have to explain to you and point out that section to you in those patient rights. They'll show you where they are. Most facilities have, every facility, it's a must. You must
Mm-hmm.
post them. So they are posted. I'm quite sure no matter what hospital or clinic or facility you go to that treats you medically, they have to post those rights within that building. So you should be able to walk in any health center, any hospital, and you should be able to go to a wall and read those
Mm-hmm.
patient rights. Now it gets very sticky, you know what I mean? And so you have to pay attention and read, ask questions, anything you don't understand about the patient rights, because yes, the language is a little difficult to understand at times, but you have the right to be respected. Exactly. We don't, race, all of that. We stay away from those topics. We treat everybody the same. I don't
Mm-hmm.
care where you come from, what you're dealing with. You come in, you have to get that same respect. If there's something there that you are not comfortable with, when they put it in your hand, if you're a first time patient, ask for the manager or ask for the ex. Let them sit you down and explain. If it's something you're not comfortable with, then you have the right to refuse.
Mm-hmm.
Okay, but we can't do anything for you if you refuse. You see what I'm saying? Then you limit our right to treat. We want to treat you, so we have to explain and put these things in your hand, and you have to sign for those things. You know what I mean? Because we have to say we did get them from you. But to that point, it's very difficult to go through, and the writing is always so fine. It's very small. So
Yeah.
that's something I'm glad that question came up, Rosie, because I might even suggest to some of the admin here, this question came up on this panel. Might be nice to just bullet some of these things, at least the common questions that come in about patient rights. It might be nice to bullet those and have those as a side, and just be able to put them in someone's hands so they understand. But if they want it more robust, they have to look at that entire document.
Yeah.
So, yeah,
Because that document
it's
is,
very long.
yeah, it's very long. Sometimes it's hard to comprehend.
I mean, it is. It's difficult. We must admit that. But
Yeah.
you do have the right to ask questions. You do have the right to get your record. There are some portions of the record where you have to initial now because it's very sensitive information, and we do not release that easily. And you have to understand why, because the implications. We have a lot of stigma put on certain things, and so you don't just want to be very careful whose hand those get into when you're coming to get them. You don't want to put them in the wrong folks' hand. You know what I mean?
Yeah.
But you do have the right to request your records. You do have the right to know what's in there. And Cheryl mentioned earlier, you are part of that care team that's caring for you.
Mhm.
That's your care. You have the right to sit in and have those discussions with that care team, which may consist of the provider, the nurse, a BH worker, whoever. All of them are part of that team that cares for you. So ask the question,
And
Yeah.
but
one other
definitely get
thing,
your patient rights. Know what your rights are.
Right. Right.
I think that on the flip side of that, that satisfies all of the administrative things so that you don't go back and sue them. But I think for us, we need to have a human's bill of rights because
Mhm.
until they address us and our needs for humanity, to just treat
Yes,
us, I
humanity.
mean, patients are different than people, than humans. They separate us. Patients are
Hmm.
billable hours. Humans, we're
That's right.
humans. We have some needs that not only you can address physically, but maybe they need to be addressed emotionally. We need to have a bill of rights that enhances the total person and not just what that provider in his profession. Because I think that sometimes we look at a doctor as someone that should only be there to give medical advice, medical opinions. But until they can look at you as a whole person,
Hmm.
then all of those bill of rights, we need a human bill of rights. That's it.
Nice.
I agree with that.
Yeah, that's
Because every
nice.
patient has the right to clear information, to ask the questions they want to ask, to consent.
Exactly.
You could decline treatment, right? Because a lot of the time you go, you're like, oh, for example, oh, I have shoulder thing, oh, they're going on MRI, I'm requesting surgery. Oh, then I say, yes, no, I haven't even got a second opinion. So it's good to have a second opinion. So I find that that was helpful for, things I was going through. It's like, no, I don't want that because that doesn't feel resonate with me. I want to be able to advocate for myself and request for a second opinion. You also have the right, like Joanne said, to access your medical records, request a second opinion, like I said, and really choose your provider. Ask the right questions about what type of provider you need. You got a primary care, like for me, I have Graves' disease. I also have an endocrinologist I see, a specialist, right? I have to be up to date with that. So, so it's just making sure that you're getting the support you need depending on what's going on with you and your health and your well-being. So knowing your rights is really the first step towards confidently advocating for yourself.
And also, they should have that listed. So any provider or anyone that's working for that facility that's, caring for patients, that bio is available. You can go look at that bio. You can go deeper and see if there's anything that is concerning to you before you say, I want this person. If you're looking for language capabilities, we have, everybody has interpreter services. But you know what? That's not enough. So, you can always go a little deeper and just do some homework. Might take a little time, but it's okay. Look it up, so you're comfortable with your choice. So definitely get some confirmation there. And so you have that comfort going in to see that provider. And you can tell them a little bit about themselves as well when you sit down to have that
Amen.
conversation.
So
Can you
true.
explain this to me? So,
Yeah,
it can
Right.
happen. So this is a two-way
that's right.
conversation, So it's not only about me, it's about you too, because I'm
That's
trusting
right.
you with my life. I'm trusting you with, for your advice and everything else. So, let's talk about it. So
Yeah, this is a partnership,
that's a partnership.
Yeah, yeah. No, I love that. Thank you so much. That's been, I don't know, the conversation's been so rich. I'm loving it because I'm so passionate about health advocacy. So I'm always trying to find new ways. How do I become more confident about advocating for myself when it comes to doctor's appointments? So next question, let's move on. What are some strategies for effectively communicating concerns and questions healthcare providers? I think you kind of already talked a little bit about it, but what are some strategies you have used to communicate? Do you use the online what is it, the patient gateway? How do you effectively communicate your concerns and questions? It might not be at a doctor's appointment. It
You
might
want to
be
take that, Cheryl? You want to go first?
online.
Well, I think that they all have portals. All of the
My
hospitals have
turn.
portals that you as a
You what?
patient can go through. And I think that the most effective thing for me has been to go through the portal, my chart in my instance. And I actually not only write to the doctor, I express my concerns very succinctly. And the good thing is about once you write something, you regret it, but to say it, you can forget it. So I'm very careful about the way and the tone I take when I write in my chart
Oh,
so
yeah.
that my doctor understands that I'm not coming as combative, but that I'm coming because I have some questions and some concerns. So I think that that's the best way for me. And then, me personally, when I go into my doctor's office, I have a notebook. And as they're talking to me, I'm writing. Some of them, it gets them nervous. And what are you writing? And one doctor asked me, am I not answering you completely? No, this is for me because I need to go back and understand to see whether or not I have any more questions for you. So I think that effective communication, and when somebody says something to me that I don't understand a word, I don't care how stupid. I may feel or think that I don't understand, or I'm going to say, I don't understand that. Tell me what that means. Or either I'll sit in front of them and I'll say, Google, what's the definition of this? Because it's, I don't have time to be messing around. And especially
That's
with
right.
you thinking or understanding that I'm not fully understanding what I may, but it just may not be in the way that you can understand and hear what it is I'm saying. So I need to take every precaution that I can to make sure that not only are we communicating together, but that we're understanding what we're communicating about. So that's how I do it.
So I think for me, just knowing and understanding all of the ways that the facility that you're utilizing has the ability to communicate with you. They have my chat. I think my chat works well when people address it timely, and really get back to you on, with their timeline. If they say, if you leave a message here, we'll get back to you in a certain amount of time. I think that's a little bit of struggle sometimes, but I think that's a great way to communicate. Um, they have a new feature now, like my chat. It's a chat feature that they have now where you can live chat. But that too, to my I'm saying you have to be able to respond within a certain amount of time. Someone has to be there to give you that attention. And then, to your point, and you said, if I'm not getting it there, I might just go out on Google. I warn folks about Google a little bit only because Google has a lot of information. And those of us that see one thing and lose it, oh my God, it might be that, or might be this. I have to get to running. There's similar symptoms for a lot of things. So I don't want folks to go strictly on what they see on Google, because it could mean anything. But you want to be sure. So I don't want no one diagnosing themselves.
Right. You don't want no one self-diagnosing themselves.
Don't diagnose yourself. Don't worry. But I think the features, my chat is a great way to communicate.
Yeah.
A lot of folks still like to leave messages for the doctor to call them back. They want that phone call, phone to phone. They want to talk behind a my chat. They want to know that that's the provider on the phone and not the nurse or the medical assistant, or you know what I mean, or office advocate. They want to make sure, and so they're just comfortable with that phone call. If you give me a call when you get a minute, and a lot of providers, because they have so much on their plate, it's like at the end of their session, they're getting back to you. You called at the beginning, so they don't have time moving patients in between, So it's really hard for them to really juggle a schedule, especially when you have them back to back, and then probably someone gets thrown in there on an overbook. So that's a real day at the clinic, And I know this because I see it, and I try to help in between if I could, just to get back to you and say, hey, we got your call, Cheryl. He's going to get back to you. He's running a very busy clinic. Can you just hang in there? But this is my direct number. Call me back. I'm going to advocate for you right now. And that's pretty much the role I played all my days here at Codman, which I will continue to do because it brings comfort. It lets them know. I make sure the provider knows, and I try to make sure the provider get back to that patient immediately. You know what I mean? Because sometimes their days look like ours.
Yeah.
So, and they're human just like us. So, they just wear a different title. That's all.
Yeah.
So,
And I think that Joanne's wisdom is so unique because she's actually in there. And it's much easier to give direction, to provide support when you're actually in the system and know it. Like I'm listening to Joanne and I'm saying, this girl knows what she's talking about. She's there doing the work every day. But when you sit back and you look at someone like me, that's not inside, but a part of that whole medical care system, we're talking about two different kind of things. And we're talking about two different levels of response and care. What Joanne does is a holistic approach where she's going to take care of the inside, she's going to take care of the outside. Inside's the profession, outside is the patient. I think that for me, advocating and strong advocacy is when we can bring those two together somewhere on a middle ground where all of those needs, not only needs, but information, you know,
Yeah.
what Joanne does. How do we get everybody to do that? You know, like she said, even those providers, they're humans, they got a lot going on too, but so don't we.
That's
So
right.
how do we make it balance where we're not more considerate of those that are providing care than those that need care?
Wow. And I'm going to say the same thing for you, Cheryl, before I turn this over. You're giving me a lot of insight. I bring patient focus groups together all the time because I think it's important to hear from the patients how things are going, what concerns they have. So that is one way that we get to hear back from patients. You know what I mean? I may bring a group of 15 patients in and say, listen,
Mm-hmm.
I want to know what's going on. You have any
Yeah.
concerns, just feed them, talk to them, and we get down to the harder things. But, they're only going to share when they trust.
Yeah.
So
Mm-hmm.
trust is the big factor here. So when they trust you, so I get to hear it all. When I finish one of those meetings, I have about 10 pages long that I have to now take back to this admin team, but I don't care. I'm
Yeah.
taking it back. I'm taking it back. So my role is a little different. I am the patient experience and outreach manager now. So any experience a patient has, I will address it. I will hear it as long as
Mm-hmm.
it gets to me. If they put it in our system, that's a little different. Now I get to
Yeah.
that system and get back to that manager. But if it comes right to me, then I'm going to address it first. You
Mm-hmm.
see what I'm saying? And then I'll work with that manager and I'll work with that compliance team. But you raised a lot of great concerns. I know you see me writing over here. You should, you said the human rights. Listen, I'm listening. So I'm taking the page out of your book too, Cheryl, because you have a lot of wisdom and you've been around for a long time and you've been doing this. So I appreciate your insight here.
Thank you.
You're very welcome.
Thank you. Thank you both. You're so full of wisdom and knowledge and
Yeah, all of that.
yes, all of that. And Joanne's like the president of the, Common Square Health Center. All the patients are coming running after her, looking for Joanne because guess what? They trust her.
Yeah,
They tr-
Yeah. But trust is it's not easy. You know what I
that's
mean?
right.
yeah.
You
Yeah.
can lose it really easy too. So that's
Like Cheryl was saying, I'm like, I'm part of the system, right? So I'm always thinking of like, how do I keep like, what strategies am I using? So I've always used the statement like, I am concerned about blah, blah, blah.
Mm-hmm.
Mhm.
Like starting with that, I am concerned because I usually do bring a notebook too as well, because I can't remember everything because
That's
something
That's
right.
right.
coming up throughout the week and I got an appointment like in 2 months. You just see what I'm saying? So I like to track things
Mm-hmm.
to make sure when I get in there, I'm not playing, right?
That's
Like this is what, is going on with me. And this is what I like more information on because I like to do a little bit of research on testing. And I'm like, give me a thyroid disease, give me a vitamin D disease, test, just really being confident more than anything and proud to like advocate for me, because the
yes.
more I do it
Yes.
and I talk about it to other people, I'm hoping that I can inspire other people to do the same.
Yes.
And I was thinking like I was at a doctor's appointment and I felt like it was going too fast. And sure enough, I had to listen to what I preach and I was like, don't hesitate, pause the conversation now.
Mm-hmm.
Mm-hmm.
Right, pause. We need to slow down because sometimes we're going too fast from one point, they're going from one patient to the other. It's like pause. I need something else explained more simple, on a more simple because a lot of the languages they use, I'm like, I don't even know what that word means. Can you tell me more? What does it even mean in the simple language? Like sometimes you don't have time to go Google and research and all that. So I find that's been really helpful in just slowing down the process. So
Yes.
I felt like I leave there feeling good. I feel like, oh yeah, I did advocate for myself. I got the answers I needed
Mm-hmm.
Mm-hmm.
and the care options that are available for me, right?
That's right.
So thank you so much.
You're
Let's
welcome.
move on. We have 15 more minutes. We're going to get through as much as questions. We might not get to all of them, but that's okay. But I want to give people ample time to ask questions as well.
Mm-hmm.
So what key questions, so I think you kind of already covered this, but I think this is more for, actually, let's go to the other questions. What are some ways individuals can handle situation where they feel their concerns not being taken seriously or heard or just dismissed overall? What are some things you do or would you suggest?
So one of the things I suggest is, so when you're brand new, you haven't established a relationship with anyone in the facility yet. But if there's anyone in the facility that you have established a relationship with and you trust, and this is getting back to the trust factor, you want to have a conversation with them because they're the ones that are going to advocate for you. Not to say others won't, but they know you. They can talk about you, your personality, the way they see you, and how they've interacted with you, and they could advocate for you. And that is something also that has come my way several times.
Mm,
Because if they put a concern in and the concern is not addressed timely enough, because someone didn't get back to them to say how they're going to fix it or if they addressed it. Yeah, there's only so much we could tell you what we did, but if we addressed it, you should know that as well. You know what I mean? At least say we did address the matter. We won't get into all of the details on what we did. Sometimes folks might come back in and that person no longer here, so you could assume, and that's what we did. But that's not always the case. So it's just about coming in and talking to someone that you feel comfortable with, and sharing your concern because we have
I don't know
like
what else to tell you, my love.
we have the same process that can escalate as well. So, you have a whole department that manages concerns. And if it's not addressed, it's escalated. Okay. So we are governed by a board. I think all places are governed by a board. And so this board does not want to hear things like that. So one of the things that we do is we try to do our jobs and do them well and do them timely. So don't ever think because you haven't heard anything back, that's acceptable. You put that call back through, you speak to someone and you say, hey, listen, this has been this time and I'm still concerned about my concern. I want to hear back.
mm,
And I want to hear back now. And so some folks even get to threatening, they say what they're going to do, who they're going to go to. You know what I'm saying? So it can get ugly. It can get ugly, but you know what? You have a right to hear back when you put a concern in. So that is your right. We have the right to let you know that we did address the concern.
mm,
And I think that for me, Joanne keeps using the word trust. I don't, there's such a magnitude that goes with that. There's a feeling that goes with that word. There's an action that goes with that word.
Mm-hmm.
That's why I'm so excited about this project that we're working on now,
Mm-hmm.
storytelling to build medical
Yes.
trust, because
mm,
we know the history of the well documented history of how we, in particular BIPOC people, have been mistreated. So, therefore, the mistrust is inherent because it's always been there. It becomes a part of us. But now, what we're doing through this project is actually bringing providers and community together in a three-part learning series so that we can figure out how through curiosity and connections, we begin to build trust. Everyday
Yes.
Boston has an amazing session called Communications, Curiosity, and Connections. And they do what people need to have a listening skills. How do you listen to someone? How do you express your concern? How do you break down the stereotypes of people
Mm-hmm.
that you think may have more power or less power than you do? How do
Right.
we actually even look at a language barrier and try and get a connection? Just a real quick story. I met a woman one day in the hospital. She didn't speak English. I didn't speak, I don't even know what the language was. But there was something in a magazine that she showed me, and I laughed at it because it was funny, and she was laughing. And we sat there and we're laughing. Next thing I know, she's holding my hand, she's patting it until the doctors called us to go in. That was a connection. And I
That's right.
think that through what we're doing with the storytelling to build trust, because trust, like respect, it just can't be given. You
Nope.
have to earn that. And even though
Exactly.
there's always somebody over somebody over somebody, it's that person that you first interact with. I wish there was a Joanne everywhere because then we wouldn't even be talking about an issue of trust because we know this sister got our back. It's just as simple as that. But through this learning series that we're doing, this is what we're hoping. It can't be rocket science. It has to be, how do we just share humanity? How do we get to know each other with a connection, but more importantly, a curiosity? Who are you? What makes you tick? People say to me, I'm a Black woman who happens to be a daughter, who happens to be a mother, who happens to be a sister, a grandmother, a great grandmother, a friend, a this or that. I can give you a whole bunch of
all that
about who I am. But the
Right.
bottom line is that if you don't know me, you
That's
look
right.
and you see this elderly Black woman and you don't know too much about me. So you're not going to trust that. But if we can get together as a community, as people like this project is doing, we're bringing together the people that have felt like they've been harmed, the people that may not necessarily know that they're doing harm, and there can be a conversation of listening and learning, then we're taking a great big leap. We're taking a great big leap. So I just want you to know that trust, we throw around that word so easy, but it's something that needs to be earned. It needs to be respected. But more importantly, we need to learn how to give it too. We can't always just be on the receiving end. We have to open up. We have to become vulnerable so that we allow someone else to make that connection with us that's going to build the trust. I know that probably took it off of what the question was.
No, that's powerful. That's
Letting us
powerful.
know it's a community convo.
Yes,
So
that is powerful. Leave that right where it is. That is exactly right.
yeah, you're
We do.
inspiring hopefully all of us to do just that, show up and show out and not be ashamed of what's going
That's
on
right.
here.
But
Right?
on top of that,
Love the
in just
energy.
to piggyback with what she said, on top of that, Cheryl, you're absolutely right. But some of us have been through some experiences that don't allow that to happen so easily. Okay. And so this is one of the reasons. So, you're right on point. You're right on point. And you stand with that because you have a lot of knowledge and from all levels. And so you're absolutely correct. You're
And
absolutely correct.
how do we start breaking that cycle of scarcity and just fear and doubt? Right? We have to
Like
start
this,
breaking
like
those
this,
cycles right
That's
here,
right. Like
right
this.
now,
like this.
talking about it, being
That's right.
about it, showing up right here like we are in community, right? We need to have more conversations like this. And hopefully people on this call can have more conversations with themselves like this and hopefully transpire some of that conversation out in the community with your friends and family about advocating for your health and well-being, right? Like because that is crucial.
Crucial.
Not just for yourself, for like the community, because when people see you doing this, then they're like, you know what? I need to get more serious about my health.
Yeah.
My life is sacred,
That's right. That's right.
right? So, and your life is a gift. You deserve to be here. Deserve to stand up for yourself.
And you know what, Rosie? I think one of the things I say to staff when they come on board, because I do have the opportunity right now to welcome new hires in, and I give them a brief overview. If you're coming into the healthcare field, this is a very sensitive field. We all have family. We love our families. We only want the best for them. If you're going to come work in a facility like a hospital or a clinic, you need to have that empathy. You need to care about people. You need to care about yourself and know how to show others that same kind of love and care. If you can't do that, you don't need to be here. And that is that other strong side of me. I just let them know really quick, something needs to change. You need to show something else or leave or leave this facility. So, that's how it is because this is our community and I'm very compassionate about my work. I'm very compassionate about this health center. You don't stay somewhere for 33 years not caring.
Yeah.
So I care, and I think every patient that has encountered me knows I care, and they know if I hear, I'm going to do something about it. All that I could within my power, I am going to do that. So You're
Amazing.
absolutely correct.
When I first met Joanne, I was like, yes, we need a Joanne, just like you said, show every
Mhm,
social
mhm.
center,
That's
every
right.
corner of the
That's right.
city. I'm like, I need you.
Yes, yes.
I
So
mean,
we
how can you
need
go home and sleep if you don't treat people well?
People do. They do. They sleep better than you and I, who this nonsense keeps us up all night because we don't understand what's going
Yeah.
on, why we're being disrespected, why we're not treating like we're worthy of that keeps us up.
That's
They go
sad.
home, they sleep well, unfortunately.
Well, hopefully they'll hear now that there is another way out, and then you
Mm-hmm.
hold that person accountable,
Yeah,
and hopefully, it bring change. I'll put it like that. Hopefully it'll
Yeah.
bring
that's right.
change. I want to
With
be kind.
community, with community.
It
That's the whole thing, within community.
That's the only
Because
reason why we're here.
if we don't get it together, we
But
can't
I don't know who
expect
they talking
somebody else to come in and get it together. But on the flip side, somebody else will come in and get it together, and we won't be a part of it.
Yes.
That's all I'm
Yes. And
saying.
hopefully I don't see anything like that.
We have to be the
Mhm.
change, like
We can change it.
yeah,
That's
We
right.
can change it.
we could be the change we want to see in the world. We're
Yeah.
doing it
Because
right. We're doing it right now.
that's
Yeah.
right. Because everybody's not going to say something when they're treated bad,
Mm-hmm.
or if they have a bad experience, and they may just walk out that door and not come back. But
Mm-hmm.
then there are those that will speak up and advocate for themselves, and they make a difference. And
And
do the
hopefully,
same thing.
Joanne, it will get to you.
Hopefully it
Hopefully, it
does. I
will
would
get
want
to
it to.
you.
No.
Mm-hmm.
No, that's what we're here for. We're here to take care of each other.
Each other.
This
I
is
like it.
community. We
Yeah.
we have built up this, I love Dorchester. You see what I'm saying? Because we're in Dorchester doesn't mean you have to be treated. No, no, no. You should expect the same thing you get when you go to the Brigham, MG,
That's right.
right here at these clinics in these communities. And
Yeah.
that's how we're going to keep on thriving.
Mm-hmm.
Okay. So all we can do is teach each other. So what we share here on these calls, people could take it back and say, you know what, why don't we try this? Why don't we try
That's
that?
right.
Go advocate for yourself. Don't ever walk away from a situation that you're not comfortable with. Put it in writing.
Right.
Yeah.
Put it in writing. You have a lot of avenues. Just understand the avenues that you have to share that information in. Once you know that, then you bring power. Believe
Mm-hmm.
me, and you advocate for others who just wouldn't say anything.
Yeah.
So that's good. Communication is
If it's
key.
on your phone, use whatever you got at the moment. Because sometimes when symptoms come up and you're at work, you're going somewhere, it's hard. You might not have your journal. So sometimes I just throw stuff on my phone just to remind
Yes.
myself, hold on, I felt this sharp pain here on the shoulder, just to keep track of it, to see if it comes up
That's right.
and it becomes a concern that I
Mhm.
Yes.
bring up. Oh, thank you so much. We're almost at time, but I wanted to actually, yeah, let's do 2 more minutes of just any final thoughts, advice that you want to give to people that are
I just
shit,
I just would like to
people that are
say,
nervous or feel intimidated, like anxious to speak up. What would you say?
don't be. Don't be, just take it, sometimes we have to take a deep breath and then say, I'm going to do this, and just do it. Put them questions on paper. Sometimes we have to write it down to say it. Some of us not good at speaking, and some of us are better off at putting it on paper and asking it. But never advocate for yourself, because your health is important. You got family at home that loves you. You have family out of state here that, one big family, loving each other, caring about each other. Think about them. Think about them when you say, I'm not going to address something. So if you see that commercial that we put out when we talk about colon screenings,
Mhm.
if you look at that clip, when I put it out there, Department of Public Health put it out there, it says, go get, your colon checked, because this is key, it's younger and younger diagnosis. So it says, and I said it in there in that video, the same photo you use for this event, you know, get it done. Go get it checked. Don't walk away and don't leave nothing idle. Go get it checked, because you need confirmation, because that worryation is going to bring stress.
Mhm.
Don't stress yourself out unnecessarily. Don't do that. Go get it done so you can rest.
Mhm.
You won't rest if you think something's wrong. If you think something's wrong with you, go get it checked so you can get your rest. That's all I have to say. Advocate for yourself. And if you can't, come to Codman Square Health Center, ask me a question. I'll see if I can help you out or help put you on the right track. Even if you belong to another facility, it's all right. You could advocate that and do the same practice there because I'm quite sure they have to meet the same guidelines we do here. So it's
Mhm.
okay. Just ask the question and get the answers you need.
For me, it's you need to be fearless and you need to
Fearless.
understand your self-worth. And you
Mm-hmm.
can't let anybody take that away from you.
Oh,
I keep saying we're not victims. We're only victims if we allow ourselves to be
to
held
be.
hostage to things that we don't understand, things that we're afraid of, and people that we think have more power than we
Yeah.
do over
Be.
ourselves. So for me, it's just be true to you. And as
Exactly.
you're doing that, take somebody else's hand and empower them because sometimes it's really hard to know that you don't understand everything. But it's
Mm-hmm.
even harder when you have to say to somebody, I don't understand. But once we begin to build that trust in each other, it becomes easier and easier where we're not just one, we're two. I don't care how many chairs they need to bring into that little cubicle that they take us
That's right.
into. As
That's
many
right.
people as need to be in there with you, then
That's
you
right.
take them in there with you. And it may not be a direct relative of yours. It can be your neighbor down the street that just need to see what action looks like inside of
Mm-hmm.
an examining room
Mm-hmm.
so that they can disseminate some of their fear. I think that we need to begin, number one, to trust ourselves.
That's
And
right.
that's going to allow us to trust other people, and other people are going to allow us to trust systems that we know are so broken. But if we
Mm.
continue to allow them to be broken on our backs, on our health care, shame on us.
Yes.
Now is the time. Now is the time. We've been through. Like Joanne, I know I'm one of those people that I got a story to tell you about
Oh
medical
yeah.
mistrust, but the bottom line is that the stronger I get, but not just because of me, but because of those that stand beside me. I don't need anybody in back of me, pushing me, pushing me. I need somebody beside me where when
Walk
I
with you.
lean a little bit this way, they pushing me up this way. When I lean that way, they put. So I'm always going to be standing firm in number one, who I am, what my values are, what my belief
That's right.
is, and what I need to do to trust you so that you can trust me. And we just get together as people and take care of each other on a very, very human level. That it sounds so stupid, so simple. Humanity. How do we just be human beings with each other that show how we care for each other, how we talk to each other, how we listen to each other, how we connect and communicate with each other? That's all I want. That's what I deserve. That's what I'm going to get. And I hope you all will just go with me to get it too. That's
That's right.
We're coming. We're with you. We're right.
that's
That's
all.
powerful.
We marching through. Yeah. No, thank you for what a nice way to like end the segment. Yeah, even if you feel anxious, because sometimes I do feel anxious, and if you don't feel confident enough, bring a trusted loved one, whether it's a friend, community member, call somebody. So
Mhm,
that way you could feel more at ease and
Yeah.
have all your information written down so you could show up and show out
Show
mhm,
up
and
and
really
show up.
advocate for yourself,
That's
mind,
right.
body, spirit, holistically, because other things could be going on in your life, right? So um, don't, it's hard to say, don't be afraid. See if you can be a little bit more courageous about asking these really tough questions.
mhm,
Sometimes it can get uncomfortable, but we got to get comfortable with being a little bit uncomfortable.
mhm,
That's
Yeah.
what it
We
takes.
can't change that.
We can't
I
change
mean,
it.
those are just the feelings that we have.
Yeah,
But we can get stronger.
you
We can
get
do
it.
that.
Yeah.
that's right.
We
Thank
can
you
definitely
so
get stronger.
much. Oh my God, we're ready for questions. I know there were a couple of hands up. Feel free. I'm gonna go through the chat. Let me see. There's a lot going on here in the chat, but I put the Everyday Boston website on there. If you want to check out Cheryl and the work she's doing and the organization's doing there, feel free to join the movement. But feel
Is she
free.
gonna share that information? Because, she said it's called Curiously in Connection. Is that a
Curiosity and Connections
Curiosity in Connection?
workshop.
You have a flyer?
We do.
So
We
can
go to the
you email-
website. I can send out flyers. I can do whatever information you need.
Okay,
I
if you
would,
could email it to me, I can send it to the follow-up email so
thank you.
people have that
I
resource.
sure will.
Thank you.
Knowledge is power, take action. I seen a couple of people's hands up. Was it Deborah? I was trying to keep it down. I think it was Deborah. A few people want to come off. Anyone wants to raise their hands up? I'm going down the chat to see if there were any questions. I felt like I saw some in the beginning. This is your time if you want to come off mute. I don't see any questions. I feel like there was a few hands up. What happened?
They probably got them answered in some of the discussion.
Good evening.
Good evening, Feluke.
Hi. Hi, Posey. This was absolutely powerful and needed. I have a question regarding like a workshop. I work with 55 plus seniors in Roxbury, and I would love to have you guys come out to speak about advocating for their health. Most of them, their family's not around or they're by themselves, and to do a workshop around advocating for your health and the questions that they need to ask. Is that something that that we can collaborate on with, or do I need to do a sidebar
I'm definitely
conversation?
interested.
Joanne, that's you. That's all you, Joanne.
That ain't all me. That's you. Yeah, listen, I felt like we was a dual team here, Cheryl. But I am more than happy to work with you. I'm happy to work
Okay,
with
thank you.
any organization in these communities because that's what we're here for.
Thank you so much. I will reach out to you, Miss Joanne, so we can collaborate and get you to the Kenzie building where the seniors are.
Okay, that's a plus.
Thank you. I
That's a plus.
appreciate it.
They count. They have a lot of wisdom.
That's right.
They can
Yes,
sure
they
teach us
do.
all something. So yes.
Oh yes, they teach me something every day.
And number
Thank
two,
you.
we vote, which means that we can change policies.
That's
So
right.
That's
let's
right.
not forget
That's right.
about that.
That's right.
That's right. Yes, I love it. Thank you.
You're very welcome.
You have a hand up. Lily, is it Lily?
Yes, ma'am.
Feel free to come off.
Good.
Oh.
Can you hear me?
Yep, we can hear you.
Good afternoon. I got in a little late, but this conversation is very powerful. I am one person, I believe in advocating for myself, but sometimes you don't know who to go to. I actually had to change my primary care for that reason because they kept giving me appointments on Zoom. Now I understood when COVID was going on, that situation. But if I'm calling if I have an appointment for a physical and then they still want to see me on Zoom and I demand that kind of service, I wind up not getting it. So I had to change my primary care. But as I listened to you guys, so who would you go to contact? I mean, how would you go about advocating for yourself? Because you talk to the people at the desk and they just being passed over what is being told to them. So how do you get behind the scenes? I did one time talk to, I forget what you call them, a patient advocate. But I didn't get very far with that. But with that being said, the question that I wanted to raise, my biggest concern now is that I'm on a CPAP, and my CPAP has been giving me trouble. And every time I call the service that I use, I don't mind even saying the name if it's okay, or the service that I use, I keep getting put on hold. I tell them the problem with the thing. They say, okay, let you talk to this person. I wake up in the middle of the night one night and my CPAP was burning hot. I had to actually unplug the thing and take it and sit it somewhere. It wasn't smoking. It was just hot, hot. I haven't got nobody to call me back. If I do get someone, I'm put on hold and transferred to the next person. So who would I go by? I mean, only thing I know is to go to my doctor, and I don't know if that's where I'm supposed to go.
So,
So
I mean, my advice would be to file a complaint or grievance, because compliance would be who I would reach out to, because now continuity is coming into question. So, this is your care and you're saying to me that you have to get a physical and they're not bringing you in-house for a physical. That's concerning. So,
yeah,
you have the right to a physical. You have to be touched, blood drawn, there's things we
exactly,
check everything. And we can't do that over the phone or through a telemed visit. We can't do that.
exactly.
So, if you can't get what you're looking for there, you file a complaint and let them look at that and see why that took place. I don't know if more training is needed for those individuals, but they should know how to escalate matters. They have to know how to advocate for you, because we're all
Yes.
advocates. Everybody that works in healthcare is an advocate for the
Should
patient.
be,
So they
should
should know
be.
how to move, no, and address that matter for you. And you're already dealing with a situation that requires you to be seen or get in touch with your provider on a regular basis. So there's no way you could let that go. I would file a complaint so that someone can go figure out what's going on and have a conversation with your provider, even to see why they're not reaching out, even just to check on you. How's it going? Um,
Hmm.
you know what I'm saying? So that would be
Yes,
my
ma'am.
advice to you. Cheryl, I don't know what you have to add.
Well,
Well,
with that, I did change my primary because I wasn't getting help. So, I bypassed that. But the problem that I'm having right now is my CPAP. I'm not getting nobody to call me back with that service. So, I mean, do I,
I can only speak on behalf of what Codman does, and I would think anyone would do that who has a patient that's using equipment from a company. Now,
mhm,
it's not if we have to now call them up and say, listen, she's experiencing XYZ with this equipment. Now, you need to get somebody over there
okay,
because we're all managing your care together. So,
mhm,
if this is a company that we can't trust because they're not doing our patients right, and
mhm,
following up and making sure the equipment works properly so that it can treat you, then now the organization needs to start considering, well, maybe we need to let this company go. Maybe there's somewhere
absolutely.
else you can go. And we know certain insurance companies only deal with certain folks, but I'm quite sure there's someone, better, who can
okay,
make sure that your equipment works, because your facility needs to know that. And your provider and that provider team need to be reaching out to them and saying, listen, what are you doing? Our
That's right.
patient this is impacting my patient. So, I think that facility you go to needs to make a few phone calls.
okay.
You know what I'm saying? Because they're the ones
Yes,
that's
ma'am.
going to make it happen.
Yes, ma'am. Okay. Well, thank you.
No, you're very welcome.
Mm.
Thank you so much. Hopefully that was helpful, Lily.
No, it was because actually I was gonna reach out to my doctor to let him know what's going on, but I've been trying to deal with the care center myself. You
Mhm.
know, calling back and forth and all the runaround. So I haven't actually told my doctor what's going on.
Okay.
Oh,
Okay.
Now is the
definitely.
time. Now is the time.
Yes. Thank you.
You're very welcome. Kimberly.
Hello, everyone. Cheryl and Joanne, Thank you so much for this panel. This was so much needed. I've learned so much and I'm excited to advocate for myself, honestly. But I have a question. I'm a caregiver for my mother, my elderly mother. And, that can be sometimes hard, especially because, for my mother, in this case, my question is, how can I best advocate for my mother's health when she's unable to clearly express her needs?
Mm.
So are you her proxy? I mean,
I am.
you could speak for her?
I can, but it's different when she's the one feeling the pain or, feeling the symptoms. It's kind of hard for her to express it to me so that I can best advocate for her. So I was just wondering if you had any other tips or feedback.
So is she comfortable writing things down? I mean, because listen, so we as parents sometimes have a lot of pride. And it's hard for us sometimes, to say to our kids, oh, I'm really having a hard time walking. We're really trying, so I have I have a bad knee that I need to get surgery on. And so I try to straighten up around my daughter so she doesn't see it because they're going to worry. And just like you're worrying. And so it's hard for us sometimes. So is she comfortable? Would she write it down for you and say, Kim, this is how I'm feeling. So you guys can have a discussion. And then if you say, I want to talk to your doctor about this, maybe she'll be okay with that. Because there may be some things she probably don't want to say. You know what I mean? To the doctor, but
Yes.
she'll say to you. Because if she's letting you care for her, she trusts you, and you're her baby. So, she loves you and she knows you love her. So trust is definitely there and she knows you care. So I would say, Ma, can you just write it down if you're feeling anything? I don't care if it's pain, thoughts, anything. So I can take that and advocate for you. You know what I mean? I mean, that's just a way to make it happen because everybody don't want to talk about it. Some people talk about it and get very emotional. You know what I'm
But
saying?
Kim,
And then they break down, so you don't get nowhere. So I would probably try to ask her if she could write down what she's feeling. Even if you start something on a daily basis, just come up with something and just a way. Say, Ma, I was just thinking maybe we could communicate daily. I just want to know how you're feeling every day. You don't have to focus on what the issue is because then she's going to say, oh, you're doing that just because you want to know. No, just come and say, this is a better way because I know I'm busy, man. I might not hear you sometimes. So just write it down for me. Use some of them little techniques and, it might work. As
but
long as she ain't
Thank
on this
you.
call. She on this call? No.
Kim, wait.
No.
I'm sorry, Joanne, but Kim, I just want you to know that before you can take care of your mom, then you need to take care of you. Because the tough assignment that you're in right now
Tough.
is a place where you need to be that loving, supportive daughter and not in the position so much of fighting a healthcare system on behalf of your mom, because
Yeah.
you need to take care of yourself. And that way you can take care of your mom. And I would put the medical professionals, let them do their job.
Yep.
Make them become advocates for their patient to make sure that they get the health care that your mom needs. I feel what Joanne says. It's about your mom maybe not telling you the pain, but you seeing the pain, you feeling the pain, but you don't have to absorb that pain because
That's
for
right.
me, a mom, a grandmother who's just so blessed. I have 2 adult granddaughters living in the house with me right now. One just applied to medical school. And I know that times, like Joanne said, I just buck it up, because I don't want them worried or concerned because it's really not their responsibility. Their responsibility is to love me, to support me, to get me through that pain on a real emotional level. It's the provider's responsibility to take care of that pain physically. So take care of you and see where it is that the providers need to come in to take care of. Because first of all, your mom may be more open to a provider than to you because she doesn't want you worried.
Nice.
That's a
Thank
good
you
point.
so much. I
Yeah.
really appreciate this. And I'm going to take these tips and put them into effect to see if I see a difference. So thank you. This was much needed and helpful.
Kimberly, I have a question. Does your mom
Mhm.
speak English?
She understands English, but she speaks mostly Spanish, so I'm also her translator.
Okay, is her physician Spanish speaking?
No,
Mm.
we're finding that to be a hard,
Yeah.
it's
Yeah.
hard for us to find one that's Hispanic.
That actually speaks the language. Yeah, that's
Mhm.
It's hard to find primary care physicians in general.
right.
Yes, agree. Yes, absolutely.
Yes, yes, I agree.
Thank you for answering my question.
Thank you for asking. Thank you to Cheryl and Joanne for taking the question and answering it with so much passion and insight and wisdom. I feel like there's some shy people in here. Where you at? I seen some hands raised up earlier in the beginning, but I don't see no questions in the
I know
chat.
I did see
There's
some.
a few.
Yes.
Yeah.
Don't feel shy. Feel
That's
free
what I just put. I was
ask.
like, feel free to raise your hand, ask your questions. If you feel like you need to get off mute, you don't know how to raise your hand, get off mute. This is the time. We got you. But I did.
I just have one more question. Is
Yeah.
there a group about learning how to advocate for yourself, or is this just one program today?
It's our monthly conversations that happens every month, last Thursday of the month, in
Oh,
collaboration with Union Capital. We always have a different topic around one of our initiatives, whether it's mental health, food, nutrition. Oh God, so many more I can't even think of right.
okay,
But there's a different topic every month. Next month,
okay,
we're gonna be collaborating with InFact around food access, and we're gonna have two panelists there talking about linking how what we eat is linked to how we feel, um,
okay.
and also connecting to food with mental health, how it affects your mental health.
Oh, okay. This is great. I really
It'll be
enjoyed
on
this.
UC app again. So every month we have this community convo last Thursday of the month from 6 to 7:30.
Okay, thanks.
Yeah. I'm gonna put in, I did do it a little earlier, but I just put in, if you want to take a few minutes before we end, please take a few minutes to complete the survey. Let us know how we're doing. Let us know any topics you're interested in that you want us to discuss. Or bring a panelist to come to talk about it, or even just, anything you can think of that you're like, you know what, I need more resources around this.
So I have a question, Rosie. One of the things that I would like to see, I haven't been out much. I lost a son a couple years ago and kind of went, I kind of fell off the radar. Kind of withdrew myself. But for families or parents and that are grieving, are there any groups or, I mean, just, not, I talk about a lot of my patients and, we have a lot of conversations and, just something that's not where, they have to go far to get to, any in the community where they just bring folks together and just let them share. Um, they don't even have to do much, but just give them a safe place to kind of express how they're feeling, what they're going through, and share. I mean, I know we have to have counselors there because you never know what might happen. We want to be able to deal with things as they happen. I don't know. I just think that's a topic that's kind of tough. And it can get very emotional for folks and, feeling this because, even though it's been years, sometimes it just seems like yesterday. And so, they're going through it. And so, I spoke to my team here to see if there was anything going on. I even reached out to the Mass League to see if there's anything. So, I mean, I think that's an area we could use some support. I mean, I think there's a lot of families out here that can use some support when it comes to, just grieving, I don't know how else to put it.
Yeah,
I would try the Peace Institute for one, And I would also try Mothers for Justice.
I just
Now,
put
it
Mothers for
may
Justice.
seem like they just focus on victims of homicide, but grief is grief. So I would reach
That's right.
out to those two organizations, and even if they can't give you the kind of support that you might need right now, I'm sure that they can connect you with other support places that can. But start with those two.
Are they groups like where you can kind of, so, I'm looking for that setting, for a lot of folks, so they can partner with someone else there. You know what I'm saying? Even though we bring them all together, you get to meet somebody in the group, and then you two can reach out and start a relationship and be each other's support system. Uh, not so much one-on-one counseling, but or just so they can link up with other folks going through what they're going through and share these stories. And then, who knows, they have someone to speak with when they're feeling some type of way. Um,
Try those organizations.
so it's Mothers of Justice,
Mothers for Justice
Mothers for
and the
Justice.
Peace Institute.
Okay, thank you.
Are you talking about the Lewis Brown Peace Institute?
Yes.
Yep, that's what I was. Okay, I'm gonna put the.
Oh, okay, yeah, I do get some of the
those two I
mailings
know
for
of.
that one.
Yeah, I
Mhm.
know. Yeah, those are the only two I know of. Okay, I'll put
I
Yeah.
that.
didn't know about the Mothers for Justice one
Yep.
though.
They do a lot of great things, Mothers for
They
Justice.
do.
A lot of
And
things.
like I said, they can connect you, or maybe somebody within there, you, Joanne, can start a support group within that organization.
Yeah, that's what I'm looking to try to do, a
Yep,
little bit of red tape.
that's
Um,
right.
But I'm gonna find a way around to make it happen. So we have a good CEO now. Not like we didn't before, but he's just more community. You know what I'm
Mhm.
saying? And so that's what I wanted to see come in here. And so we have a powerful CEO. He's a community guy, and he's even participated in all the walks, all the talks, everything.
Nice.
So
And
that's powerful. So
Yeah.
I'm hoping to see things.
I will
Mhm.
check those two organizations out. You can even, I'm pretty sure the Lewis Brown Peace Institute does something like that.
Okay, I'm gonna inquire.
Yeah.
But I would definitely look into actually both of them to see
Oh,
what.
yes, most definitely. Thank you.
Oh, we have some hands up. Yolanda? We got another few minutes.
So MJE does do trauma support group. If you go on the Mothers of Justice website, they have a calendar where you can join groups. I've been with them since I had my first son, and when I say they have been an inspiration in my life, they have been an inspiration in my life. And I have 3 kids and my granddaughter that I take care of full time. You say hi. But they are really good when it comes to support groups and trauma, because that's what they do. They also do the Mothers of Justice Peace Walk every year
Mhm.
on trauma and those that lost children, parents, or any kind of someone that you lost in your family. They do work with people like that. And when I say they are a good organization, you would not be sorry. You will be leaving there happy, because
Okay.
they really do support and help people when it comes to trauma, because that's what they're all about. They stand for trauma because that's what they're all about. MJE, they do the Mother's Day walk every year. And the Mother's Day walk this year, when I say it was a success, it was a success. I volunteer every year, and I have been through so much in my life, losing people and stuff like that. I lost my mom at the age of 13. And I've been with MJE after that, and I would not be nowhere without them. They are my support, and they really help me. I have anxiety and depression really bad, and I'm really close to one person there, Aretha. So she really knows me. So when it comes to my anxiety that gets really high, she's like the only person that can really like calm me down and stuff like that. But you won't be sorry if you go to MJE.
Thank you,
They're
Yolanda.
very, very supportive.
Thank
They're
you.
very supportive.
So much for that.
I appreciate that feedback.
Yeah.
You're welcome.
T. Alexander.
Good evening, ladies.
Yeah.
Hi.
So, I've been just listening to y'all, and everything. And so in the midst of my storm, I just been advocating for me and my son that, he's just been diagnosed with a couple of things. But when you don't know the process and you're overwhelmed because everything is on you as a single mom, I know writing stuff down and getting through it or trying to get through it or get the best answers as possible, but you're getting the runaround story and you're being the advocate and you don't know which way to go next. And you're getting it from all sides, the school side, the doctor side, and everything. Which I am in a battle with the doctors because I've been speaking up. My son is only 5, and I've been speaking up for him since he was 2, and I saw different things that he was doing at home, and I'm just like, no, you gotta say something to the doctors, and they just been giving me the runaround. Now he's about to be 6 years old, and we're finally getting to diagnosis. But it took us a long time, and it took us me second opinions and everything, but it's just we're still not on where we need to be. And so my question is, how do you advocate to go to the next person so they can listen to you and stop giving you the runaround? Like I'm speaking to MDs, people that's higher than the pediatricians and stuff like that to get it all together. But I feel like it's taking time and it's just like I'm the one who's dealing with everything. And so I don't know where to go because, like I said, I am talking to somebody that's higher than the pediatrician. But where do you advocate? What's the next way to go to get more information to who you know, to navigate with the next way I should go about it?
So, that's a little. So for me, all of these providers have a chief. And if you've been dealing with a provider and that provider has to report into a chief who sometimes will sit and evaluate a case. So they have case studies on a regular basis, and it's like this peer to peer. So your case could probably be one for them to take and evaluate. Because if you feel like it's taking you 2 or 3 years to get a diagnosis, I mean, it's one thing if you tell me they were doing testing and checking this and checking that, and we got to wait for this to come back before we say it's this. So, that could be a long period of time in order to come up with a diagnosis. But there's a chief
So
medicine.
I didn't speak to the chief. So I think that's where I'm trying to lead to. How
Yeah,
do I
no,
get in touch with the chief? Because right now I'm dealing with I think she's an MD higher than my pediatrician because
she
I'm at
is.
2 different places because I had to split it up and to get that second opinion. When I went to go get the second opinion, they're moving faster than where we was at the other place, but I can't so my insurance is saying that I can't go to both places because it's getting difficult now. But I didn't know how to navigate because once the MD stepped in and she was like, why they didn't do this and this, and I said, why didn't they do it? I don't know. I'm not them to put in the paperwork to get it started. I'm just the mom saying, hey, we need help. My hands raised and I'm here to get the help that we need, but it's y'all guys to put in the paperwork so we could be on a wait list or something that's happening. So, but my thing is, how do I get to the chief so they could review my son's case and get the ball going and make it all make sense? Because every time when I speak to another doctor or a therapist or anything, they be like, "Oh, this chart it's very confusing." I'm the one who's living it. Yes, it is very confusing. I'm very frustrated and I just need answers and point me to the right directions because right now I feel like I'm getting the runaround and going to this person, this person. And then sometimes they wanted me to start back over. And I'm just like, I'm not doing that because I'm not starting back over, which he already was diagnosed with something. And it's just like, you want me to start back over because it's not where y'all working, it's somewhere else. Y'all could take what they already gave him. So it's just like, so that's where I'm at. And I'm very emotional about it because you're playing with my son. And I feel like as an advocate, and I'm not trying to be the typical, stand out, be loud and
Mhm.
get upset. but I'm very emotional about it, and it's just like I'm not getting the answers that I need.
So like, I think, I'm gonna always fall back to compliance, because compliance is the only department that has, the ability to go to any chief and anyone in the facility, period. I don't care what your role is, your title, if you think you're greater than or whatever. They have to hold everybody in that organization accountable for doing their work. And if your work has to be evaluated, that is the team you put in a grievance. And you have to say why you're putting that grievance in and what you would like. You would like someone to evaluate the work your MD did. Because if you feel like time was something that was lost here, you feel like they were lagging on time, and, this is something you should have had knowledge. Maybe they could sit you down and explain all of the steps that were taking, but communication, we talk about communication again. That's key. So if they would keep you in the loop and say exactly why the time is taking this and that, then you would be better off understanding why. But because it seems like the communication hasn't happened. So I would definitely file a grievance with that compliance department, and I would ask that the chief of medicine be informed, because that chief has to go and now and evaluate that work that was done and see if now this provider, needs to get in a conversation with him or her.
Yeah.
You know what I mean?
Okay.
So
Thank you.
that's
I
what you need to
appreciate
do,
that.
because that's a lot when you have a sick child or your child that you're seeing some things happening. You want to know what's going on.
Right.
You're
Mhm.
not playing. So yeah, definitely go file that grievance. Put a grievance in and ask for that medical the chief.
All right.
These
Thank
chiefs are
you.
responsible.
Thank you so much for that question. That was
You,
such a
you're
great
welcome.
question. I hope that was helpful. Thank you. We're at time. We're over time. Sorry. Thank you so much to the panelists, the lovely Joanne and Cheryl. We love you guys so much. We appreciate your time, your presence, your wisdom, and your insight.
Oh,
Hope
this is great. Thank you for having me. I appreciate it.
you're welcome. I enjoyed
Much
every
so.
minute of it.
Thank
Thank
you all.
you, everyone. Have a
All
good
right. Thank you.
night.
Thanks,
Joanne, I'm gonna
everyone.
call you.
All
Bye.
right.
Thank
I'm
you.
open. I'm at Codman Square Health Center. Anybody want to see me, feel free.
Joanne.
Absolutely.
Thank you. Bye.
Thank you.
Night.
Bye, Cheryl. Nice
Bye.
meeting you.
Good
Bye.
night.